On this episode of the ASC Podcast with John Goehle, we discuss the latest news, including recent CMS guidance on the resumption of survey activities. We provide an update on the draft CMS payment rule for ASCs and HOPDs. We discuss LGBTQ plus patient documentation, talk about contract compliance review requirements, and we announce our new ASC Administrator Bootcamp program. This episode of the ASC Podcast with John Goehle is sponsored by Ambulatory Healthcare Strategies, the nation's leading ASC regulatory compliance firm. Are you preparing for a Medicare, state, or accreditation survey, or have recently experienced a difficult survey? Or do you want to make sure you are always survey ready? AHS is your answer. Our dedicated team of experts is ready to assist you. AHS can make you ready for your next survey, complete your plan of correction, and work with you to always be ready for a survey. We also provide retainer-based services to oversee your regulatory compliance, including preparing policies, forms, education programs, overseeing your quality improvement, risk management, infection control, and emergency preparedness programs. For more information, call John Goehle today at 585-594-1167 or visit our website at ah-strategies.com. Welcome to episode 112 of the ASC Podcast with John Goehle for August 23rd, 2020, recording from our studios in Spencerport, New York. This is Susan Cronkite, Chief Researcher for the ASC Podcast with John Goehle and Senior Nurse Consultant for Ambulatory Healthcare Strategies. Joining me is John Goehle, Chief Operating Officer and owner of AHS, recognized as one of the nation's leading experts in the ambulatory surgery industry.
So we're back in the studio. We're a couple weeks since the last episode, and we are joined this episode with our puppy, who we've decided is old enough now that she won't disturb us during it. So she's resting very comfortably in the corner of the studio here.
Yep. Hopefully there won't be any wires chewed up or anything.
That's right. If you suddenly hear us disappearing, that's why. So this is, it's been a while, so we have quite a bit of news, and we decided to do an episode on just kind of, in our focus segment on some of the issues that we've been seeing with AHS, just a couple different things.
And of course, August is National ASC Month. There hasn't been a lot of talk about it this year, or a lot of activities going on surrounding that due to, obviously, the pandemic. But I thought it was worth noting. We've all been working very hard. It's been a really stressful time. So
it's nice to sometimes sit back and, kind of reflect on ASCs. And I didn't know this was ASC month. I should remember that because it's always been August for as long as I can remember. But everything else going on right now, this hasn't been something that we've been thinking about. So hopefully everybody's out there celebrating. The best thing to do during this time is to invite, your local representatives to come out and visit your site. I think you're going to have to do that virtually now. Yeah. But make sure everybody knows that you're around. And, I did a session recently for vendors with a company that I work with periodically. I do speeches. And one of the things that we were talking about is, how we're trying to encourage people to come back to ASCs after the pandemic, after the shutdown. And one of the things that we talked about, my co-speaker with me was from a hospital in New York City or outside of New York City. And they were also talking about the advertising that they have to do, the public relations they have to do. And I think one thing that was also interesting is, patients are very leery right now of, going into healthcare organizations. And whereas in the past we, perhaps didn't make a huge deal about all the things that we do to protect them from infection control, one of the comments he made, and I agree with him, is that we as healthcare providers need to be making a huge deal about that. I mean, flagrantly, washing our hands in between patients and making sure everybody sees you doing that, using hand sanitizer. Let them see your cleaning people cleaning in between cases and procedures, and really making a big deal about this. And that'll help reassure, our patients that we're doing the right thing and we're taking care of their.
You and I have talked a lot about this, how it really is very important that people actually see it. And I know when I worked in the hospital, there often was a sink inside the patient's room and then a sink out in the hallway. And you really had to think about, you could clean your hands before you go in, but then you'd realize they really didn't see that. Which is not very reassuring. And I know you've had some recent experiences in hotel rooms.
Yeah.
Where on the one hand, the one hotel chain, it was very obvious what they were doing. They had a little tape on the door after it was cleaned, so nobody had gone back in there. You would see people actually washing their hands. People were out in the lobby washing things down.
Right.
And it made a huge difference. I mean, you can't see just looking at most services whether they're disinfected or not.
Right.
So really all you have to go by is what you see people doing, and people are going to be so aware of it right now.
Well, and I went so far as to actually complain to one of the hotel chains about this, went right up the chain, because I stay so much in hotels. Yeah. I went right up the chain of command and I said, I know this is what you've been saying on your website, but I did not see this. And again, that point being is make it very visible that you're taking all of these precautions, help the patients to see this, and then they'll spread the word out there too, into the outside world.
And a whole separate point that you just made really is to underpromise and overdeliver.
Yeah.
Because I know the one chain that you went into, my daughter and I had stayed at about a week before, and it seemed okay. Then you went into it having heard all of the promos where they had said they're going to be handing out, hand sanitizer, and that people are constantly washing their hands, and they had really made a big point of all the things they were doing. And then when you didn't see it, it just struck you as even worse than if you hadn't heard any promises at all. So that's exactly right. As we said, just try to make sure that people really do see you doing all of this stuff and make a big deal out of it. Whereas in the past, we probably didn't worry so much about that. Yeah. And that's one good thing that we're hoping will come out of this whole pandemic is I think people are looking much more deeply into where they're going for healthcare, and people have become a little bit nervous about the hospitals.
Yeah.
And, there's been some good news out there about the ASCs and infection control. So, let's really build on that and make sure that when somebody does try one out for the first time, that what they see is very positive and reinforces what they're hearing.
And one of the things that we have seen, too, is I think people are a lot more reluctant to go to hospitals now. We have seen among our clients an increase in the number of cases our orthopedic centers are coming back a lot faster than some of our other centers. And we believe the reason for that is, orthopedic cases that used to be done in the hospital, especially like totals, are now, the patients are really saying, listen, I want to go to an ambulatory surgery center. So we need to capitalize on that. Yeah,
it's a whole perfect storm of people being more comfortable in ASCs, and they're freeing up more services to be done.
Absolutely.
In ASCs. And I did want to mention, AORN is celebrating National ASC Month with discounts on some resources and some free seminars for members. They've got lots of ASC-specific articles and resources that I've noticed on their site lately, and a new certification. They're offering prep for the CNAMB, or a Certified Nurse in Ambulatory Surgery.
So we really want to encourage people. We believe in certifications. We did an episode on this, I think, about 2 episodes ago, encouraging people. At that time, I was not aware of this credential, and I apologize to AORN for that. I was not aware of it. We have learned a little bit more, and we'll put some information up on the website too, so people can obtain information as to how to do this. So CMS issued some guidance on August 17th, almost a week ago, and the title of it was Enforcement Cases Held During the Prioritization Period and Revised Survey Prioritization. So I'll give a link to this on our show notes. But basically what CMS said is that they're committed to taking critical steps to ensure America's healthcare facilities continue to be prepared in response to the threat of the 2019 coronavirus disease, or COVID-19. And with this particular guidance, they're providing information to state survey agencies, better known as SAs, on resolving enforcement cases. And they're providing guidance on resolving enforcement cases that were previously directed to be held, and providing guidance on civil monetary penalty collection. It's kind of interesting. It's very rare that we see the monetary penalties being invoked. There's certain states that will do that, many that do not. So it's interesting to see that specifically noted in this particular guidance. And again, the point being is that they're trying to encourage the SAs to get back into providing, doing surveys, and if they have to. Well, another thing they did is they expanded the desk review authority. CMS is temporarily expanding the desk review policy to include review of continuing noncompliance following the removal of immediate jeopardy, or IJs, which would otherwise have required an on-site revisit between March 23rd, 2020 and May 31st. 2020. They're also issuing updated guidance, or they did issue updated guidance for the reprioritization of routine SA clinical laboratory improvement amendments, CLIA survey activity subject to the SA's discretion. Now, this doesn't really impact surgery centers in general because most of us are under waivers, but those of you that do have CLIA laboratories that are not waivered, and we have a couple clients, for example, that do that, this would affect you. So in addition to lifting the restriction on processing CLIA enforcement actions and issuing the statement of deficiencies and plan of correction forms, CMS is also revising guidance on the expansion of survey activities to authorize on-site revisits and survey types. So in addition to ongoing focused infection control surveys, which we know have begun, states are encouraged to resume normal survey activities. So we knew it was coming. It's a little bit sooner than I thought, given everything else that's going on. And of course, this is very state dependent. So we live in New York State. We know that survey activity in nursing homes have been to an extreme right now, and really has taken a lot of the resources away from the Department of Health because of a lot of problems in the nursing home industry here. So in addition to these infection control surveys, states are encouraged to resume normal survey activities while also addressing the backlog of surveys that were postponed as directed in earlier guidance. Once a state has entered phase 3 of the reopening based on the White House guidance on reopening, or earlier at the state's discretion, states should resume normal survey activities according to guidance that were issued in the fiscal year 2020 mission and priority document provided by CMS to the states, while prioritizing their backlog as follows. So this is the prioritization level for the different types of surveys that would start. The first priority is revisit surveys for past noncompliance that do not otherwise qualify for a desk review. So if you've had issues in the past with regard to noncompliance specifically, and what we're referring to here is a lot of issues with regard to infection control that required an immediate jeopardy usually, or you ended up with a condition level citations. Those are going to be prioritized revisit surveys. Complaint surveys, triaged as non-IJ level or higher that have not been completed. So if you had a complaint survey that had not been, or if you had a complaint that had not ended up in a survey, that will now start. Initial surveys of new providers, thank goodness, because we have a couple that are waiting approval. Past due recertification surveys with statutorily required survey interval, and past due recertification surveys without a statutorily required survey interval. So that, and again, we have a couple recertification surveys that are past due right now. So that is that's part of the prioritization. So I guess the news is CMS has directed the states to start back to doing survey activity, but it is going to be in that prioritization or list. And then, Sue, we know that in early August, CMS issued the HOPD and ASC regulatory update. We talked a little bit about this, I think it was in the last episode, but just to kind of give you some more information about it, there was a 3.0% inflation update, less the productivity adjustment that's required by CMS of 0.4%, bringing the rate down to 2.6%. Now, note that this is the same rate for the ASCs and the HOPDs. That's something that happened last year when they finally equalized the method by which they update for inflation. And you have to remember, this is very important, that this is an average and that rates will vary considerably. Rate changes are based upon this black box formula that I've talked about in over the years that uses data provided by the hospital cost reports, the annual Medicare cost reports. And they use that in order to revise the various rates for the different specialties. Depending upon what specialty you're in or what specialties you have in your organization, those rates will go up by, some CPTs will go up more than the 2.6% and some will go down less than the 2.6%, depending upon your specialties. We'll provide links to the rates in the show notes, and it was in the previous episode also. I did find it interesting. I always find this interesting. Look at the conversion factor, which is the formula they use. Sue's already fallen asleep over there. She's petting the dog, actually, as we're talking about this, because and I'm sure some of the nurses have probably faded out already.
Well,
but
nurses are not. Some people like finances.
So the conversion factor is part of the formula that's used to determine the rates that that Medicare pays for. And the conversion factor for ASCs in 2021 in the proposed rates is 48.984. And for hospital outpatient departments, the conversion rate is 83.697. So that means that ASCs are paid or are projected to be paid in the 2021 rates at 58.5% of what HOPDs are paid. I always find that very interesting. I mean, first of all, this is right in the regulation, so it doesn't take much to look at this. And I like to use this as a marketing tool. That means that, obviously we get paid considerably less for the same types of procedures. Now, albeit in the hospital, of course, there's a lot more services that are available than in the surgery center, but we're talking about the same types of procedures that are being performed in an outpatient department. And then also remember the patient's Medicare copays are the same 58.5% of the HOPD's rate. So use this in your marketing to kind of emphasize how much patients can save as well as the government can save by using an ambulatory surgery center. As you said, Sue, this pandemic has been an opportunity for us to kind of really, get ASCs out in the forefront here. And it's not just, the quality of care that we're providing and the safe environment that we provide because of all the things that we're doing to protect our patients, but it's also because it's a cheaper mechanism or a cheaper location for patients to receive the care. CMS is also proposing to add 11 codes to the ASC CPL list in 2021, and these codes are, why don't we just go back and forth on this? And I'll give you the ones that are difficult to pronounce. Implantation. So the first one is 2 codes for implantation or replacement of carotid sinus baroreflex activation device. I have no idea what this is. But it's the CPTs are 0266T and 0268T. And I should note, by the way, that the CPT 4 codes are a trademark of the American Medical Association. All rights are reserved by them.
Transcervical uterine fibroid ablation with ultrasound guidance radio frequency is 0404T.
Open treatment of complicated, for example, comminuted or involving cranial nerve foramina. Boy, I'm sorry if I'm these are clearly cases that I'm not familiar with. Fractures of the malar area, including zygomatic arch and malar tripod. We're going to get all kinds of comments for mispronouncing this, but the CPT for it is 21365. And again, I'm going to put there's references on a website to the regulations here.
Okay. And
you get the easy one.
Total hip code 27130,
which is total hip arthroplasty, which is very exciting because first of all, can you ever imagine having total hips being done in an outpatient center? I remember my mother having it 15 years ago, and she was in the hospital for 5 days, and it was amazing that she was only in the hospital for 5 days. I remember them thinking, "Oh my goodness, she really wants to get out of here." Knee implant with a 27412.
2 colpopexy codes, 57282 and 57283.
And there's a new laparoscopy code, 57425.
2 lithotripsy codes, C9764 and C9766.
So CMS is also proposing to add approximately 270 potential surgery or surgery-like codes to the approved list that are not on the current year 2020 IPO list, inpatient-only list. So the goal here with the newest rate update is that CMS is hoping to remove the inpatient-only list, which is a list of procedures in hospitals that can only be done on an inpatient basis. And in the past, what had happened when procedures were removed from the inpatient-only list, they were then allowed to be done in the HOPD, which then shortly meant that they would be included in the ASC list. They're trying to uncomplicate this whole process here and allow a significant increase in the number of cases that are allowed in an ASC setting for Medicare patients. And CMS is proposing to transition codes off that IPO list over a 3-year period, with the list completely eliminated by 2024. For fiscal year 2021, CMS is proposing to start with 300 musculoskeletal services for removal from the list during 2021. So that would be the beginning of those lists of those procedures being moved over to the ASC list. So very exciting development.
And lastly, no new measures proposed for ASC quality reporting program. So CMS is not proposing to remove any existing measures or to adopt any new measures for the calendar year 2023 payment determination.
So if you are interested in making any comments, the comments are due by October 5th, 2020 through the www.regulations.gov website. And I will post information on so that you can download information on the ASC HOPD rates in the show notes. And Sue, HHC issued a memo to all their providers recently. And if you want to talk a little bit about what was included in that memo.
HHC takes the health and well-being of our clients and surveyors very seriously and has implemented a number of protocols to ensure the safety of everyone involved throughout the survey process. Surveyors have been designated as providing services to essential businesses as defined by the 2020 guidance on the essential critical infrastructure workforce, issued by the Department of Homeland Security.
And they actually issued me a letter that I carry with me when I'm surveying that allows me to go into states such as New York, which has a mandated 14-day quarantine for people coming from out of state. So note that for any of your surveyors that are coming from out of state, they do have that letter available to you.
Each surveyor conducts a personal risk screen. The personal screen determines the surveyor's ability to safely perform a survey in advance of acceptance. Prior to each day of the survey, the surveyor conducts a self-screen and follows the screening requirements of the health facility being surveyed. Surveyors also practice social distancing, meticulous hand hygiene, and cough etiquette during the survey. So are you required to take your temperature before you come in? Or?
Yeah.
Okay.
In other words, do the same things that we do. But again, the whole goal is to make sure that before we actually go in there, we're not finding out when we arrive at the site that we might have a problem.
They check you when you come in.
That's
You're
right.
supposed to do that before you go.
Which is, by the way, is good practice for everybody. I mean, I think if we've had a couple of situations recently where employees, I can't believe this is still happening, but employees have showed up with clearly having a fever and having to be sent home, and then of course causing problems because concerned that they might none of those situations ended up being a patient, or an employee that had COVID-19, but you certainly want to avoid that possibility by self-monitoring at home.
Or anything else. As we move into the flu season, we don't want people, they're concerned about having the dual issues going on. So if you're sick, stay home.
Well, and that brings up another interesting point. In the past, we were joking about this the other day, just between the two of us, is, employees that showed up when they were not feeling well used to be praised because their
Great
dedication. That's right. And
take
not
out the rest of the organization.
That's right. And not letting down the rest of the employees. And now they're going to be ostracized if they show up for work sick because of the danger that they pose to the other employees. Yeah.
So going on, HHC closely monitors COVID-19 activities in areas of upcoming surveys and requests that client organizations with upcoming surveys either scheduled, non-Medicare deemed status surveys or submitted application for Medicare deemed status accreditation or reaccreditation, contact HHC if there's any COVID-19 related activity in their facility. And are they actually reaching out to
and they
places?
do reach out, I believe, prior to the survey just to make sure no changes have occurred. So it's important to note here that they're not asking you to communicate any COVID-related activity that you have in your organization only if you have that activity and you have a pending survey coming up.
Yeah, it's not a reporting requirement. It's
Correct.
just it's a safety thing. And the HHC survey practice has been altered to maximize social distancing and safety, including scheduling surveyors within driving distance when possible, utilizing appropriate PPE for the entirety of the survey, limiting the numbers of individuals in group sessions and activities, simulating an activity where possible if surveyors are unable to enter a high-risk space, maximizing the use of technology such as screen sharing or projecting documents, medical records, or policies in a larger room, conducting interviews with patients or staff by phone, using phone calls or video conference calls to expand the number of attendees able to safely participate in the summation conference.
So we actually did this. We had a survey about 2 weeks ago, and the medical director was not on site, so we plugged him in using Zoom. We all are familiar with Zoom now. Zoom is becoming like Kleenex, that generic term. But it worked very well. And, we were able to see him. The surveyors were able to see him during the exit conference. He was able to ask questions. I don't think he fell asleep, though. He didn't seem to be terribly excited in this particular case. But fortunately, it was a great survey, and there weren't a lot of issues identified, or almost no issues identified. So he had every reason to do that. And until we got to the end, when he was everybody was being praised, and he was praised for the work he did. So he paid a lot more attention.
A boring survey can be.
That's right.
Survey.
I like boring surveys. Give them to me any day.
So any surveyors who have had exposure to COVID-19 within 14 days of a scheduled survey are removed from the survey team and are directed to follow the direction of the CDC and state and local health authorities prior to returning to work. Furthermore, surveyors experiencing cold or flu-like symptoms are prohibited from conducting HHC surveys.
And HHC has developed a number of resources to help their clients navigate challenges during the pandemic, and that's all available on the HHC website. So we have been monitoring the other survey organizations. HHC has provided probably the best and most specific information. Joint Commission also has specific, and I'm going to provide a link in the show notes here to their COVID-19 section, because Joint Commission, of course, is much broader. I mean, it has hospitals and other organizations well beyond what HHC does. It's a little bit harder to get to the outpatient section on the website, but there is a nice link for that's specific to ambulatory care,
and a webinar
and risk assessments and other resources. So we don't have the same level of detail that we do for HHC, but it is available there on the Joint Commission website. And I really encourage everybody to communicate or at least read the communication from your accrediting organization, even if you're not due for a survey soon. There's just a lot going on, and surveyors are going to be doing, as we noted, they're going to be doing things very differently, so you want to be prepared for that. And also, they're probably going to be using, HHC definitely is using a different checklist than they've used in the past, so you want to definitely see, and that checklist is available to you to see prior to the survey. So I did want to announce that the ASC Finance, Accounting, and Reimbursement Fall Seminar, you might remember we did a spring seminar, is coming up. It's been announced, and the dates are December 3rd and 4th. This is a follow-up to the spring seminar, which was a huge success, and a recording for that seminar is available at the ASCPodcast.com website. So if you missed the spring conference, definitely go see a recording of it at ASCPodcast.com. So the ASC Finance, Accounting, and Reimbursement Fall Seminar is a joint production of the ASC Podcast with John Goehle and Christina Benton of Coding Compliance Management. And the fall conference will include, so this is what's really exciting, is we're going to have a lot of information on the final 2021 HOPD ASC CMS regulatory compliance update. And Christina always does a great job of summarizing all that information, showing us the reimbursement impact. I'll give a regulatory impact update, though. Fortunately, I won't have as much to talk about as Christina will this year. So definitely sign up for it. The sign up is not available yet, so just keep checking on the ASCPodcast.com website. So what we're going to be doing during the fall conference or fall seminar is more finance and accounting and reimbursement topics. We're going to extend our discussion from the spring conference, including more advanced topics, discussion of revenue cycle and reimbursement, advanced financial management, advanced budgeting and financial projections. We're going to talk about strategic planning, which we really just touched on a little bit during the spring conference, specifically in the ASC setting. So as I said, sign up will be available soon. And for more information, check in regularly at the ASCPodcast.com website. And Sue, we are very excited to announce the Administrators Bootcamp. This has been a dream of mine ever since you've known me. This has been something that I've wanted to do, and we decided to pull the trigger. We've announced it. So to prepare for the challenge of ASC administration, we want people to participate in the ASC Administrators Bootcamp. It's a comprehensive program to prepare ASC administrators for the challenge of leading and managing an ambulatory surgery center.
And the boot camp includes reading material, virtual private consultations, and an intensive 4-day virtual conference, which will be presented January 26th to the 29th of 2021.
And so this program is going to be designed for new administrators, which we're going to have a lot of new administrators out there as a result of, it's been happening anyway as people have been retiring. We've known within our own company I think we've had a bunch of retirements and a bunch of people that have moved on to other careers as a result of this pandemic. So this is a great way for new administrators to learn everything that they need to know to be a good administrator or nurse manager also.
This is such a valuable skill to have.
Right.
You would be in demand, definitely.
Absolutely. It's also geared toward administrators that wish to enhance their skills and for administrators that wish to prepare for certification as an administrator. The ASC Administrators Bootcamp is the industry's most comprehensive preparation for the role of the ASC administrator.
It's going to be presented by you, John, and I will be your co-host. This highly interactive program will be presented to a limited cohort of students, and it's going to be done through private virtual meetings and a 4-day interactive video conferencing, which will allow you to see the speakers and the other attendees, if they wish, and to interact as much as you would in a live conference. So I think one of the things that's so exciting about this is, with the availability of Zoom, we're going to do two, maybe more, but at least two-hour virtual conferences with each of the attendees, which is why we have to keep the cohort kind of small here. Okay. So one will be before the conference, and it could be as soon as when you sign up, and sign up is available now, just to kind of prepare you for it. What I want to find out before we actually have the conference is what are the needs of each of the people in the cohort here. So when you say a 2-hour conference, you mean a 2-hour discussion ahead of time with each specific person? Individually, correct. Oh, that's great. Yeah. So at the end. See, I'm learning about it as we go. That's right. But that is good because that's what you miss so much in the, without being live. Well, and we've always done mentoring of all of our administrators in our in ambulatory healthcare strategies. So this is a way for that same type of a service to be offered to people virtually anywhere in the country. And then we're going to do another 2-hour session after the conference just to kind of answer any questions that they might not have wanted to ask, or to kind of just kind of get them prepared for their career there. Maybe they have some questions about what their next steps are. And everybody's going to have that slightly different take on it and where they'd like to take their career. Right. And everybody has different experiences as administrators too. We'll give like the standard, responsibilities of administrator, but definitely this is an opportunity to have a one-on-one conversation with me. And in addition to the slides and other resources from the conference itself, attendees will be provided with copies of 3 of my books, including the survey guide, the survey checklist, and my book on ambulatory surgery center governance. And as we mentioned, 2 virtual personalized 2-hour sessions and 1-year membership in ASC Central, which is the membership website for the ASC Podcast with John Goehle. And you'll get that upon signing up for the program. Attendance is going to be strictly limited and is expected to sell out. So sign up today at ascpodcast.com. The total cost for the bootcamp, it's expensive. It's $1,899.99. And it is really the same training that new administrators of ambulatory healthcare strategies will be receiving. And recordings will be made available for attendees for 3 months after the conference. And we're considering how to make these conference materials, this conference available year round. But of course, you would miss out on that interactive nature
nature of the conference. And I expect this to be an annual, maybe even more frequently thing, depending upon how popular it is. As I said, this has been a long time in the making. We've done focus groups to try to figure out how to structure this, and this is the result of all that hard work. So, and then we also want to remind people to become a patron member of the podcast. We have a major addition and a major announcement here is that patron members now have access to some of the virtual conferences in 2020, including it's a New World Conference, which was a 2-day conference, which we presented in, I think that was in April. Infection Control in Service to Meet the Challenges of COVID-19. So this was a conference that you can present to your employees. The 2020 ASC Mandatory Education Program, again, something that you present to your employees for 2020. And the ASC Roadmap to Recovery, which was a conference really more for management. And that's starting to get a little dated, but there's a lot of good information on these things. And again, it's free for all patron members. So the patron member program, which is also known as ASC Central, is an exclusive membership website that provides a one-stop ASC regulatory and accreditation compliance, operations, and financial management resource for the busy administrators and nurse managers out there. So we call the patron program ASC Central, and it includes links to critical CMS resources, credentialing resources, FDA administration resources, OSHA resources, links to special episode content, and much more. It also has a document library with a growing list of resources, including rules and regulations, guides to maintaining compliance, example policies, which is really one of the most popular parts of that website, infection control resources, HIPAA resources, example risk assessments, another very popular section, and an example committee and governing body minutes, which we really kind of lead the industry in providing examples of minutes that are there. And also 60 disaster drill scenario kits, including the forms and checklists that you frequently use. So you also get discounts on books written by myself, and you get a discount on a personalized mock survey if you wish to do that. So for more information about this, go to our website at ascpodcast.com. Membership helps to defray the cost of producing the podcast, including research staff, travel to conferences, equipment costs, and production costs. For more information, again, visit ascpodcast.com. So let's take a short break, and we'll come back with our focus segment on various issues that we've been running into at Ambulatory Healthcare Strategies.
Is your ASC meeting all the infection control requirements in the new normal? Let the team of experts at Ambulatory Healthcare Strategies and the ASC Podcast with John Goehle help you be prepared for the new normal with a range of resources. Be prepared for the infection control challenges of your ASC. Our resources include our free podcast. We'll be adding content to help keep you apprised of the changes and the requirements for infection control. And of course, the podcast is always free.
And the ASC Podcast now has the industry's leading education program for infection control coordinators, which we refer to as the ASC Infection Control Coordinator Training 2020. And we'll be updating this every year, but this training is available at the ascpodcast.com website. This is a recording of the training program to prepare nurses for the role as an infection control prevention coordinator, or to improve the skills of coordinators that already have that position in the ASC setting. And it was recorded on April 7, 2020. This is a full-day course focused both on the basic skills necessary to become an infection control coordinator and to build on skills that current coordinators already have. Particular emphasis is placed on the infection control challenges of our current environment and preparing for more rigorous surveys in the near future.
After completing the program, attendees will receive a certificate demonstrating that they received the training. The cost of the training is $199.99, and you can get more information about it at the ascpodcast.com website.
Ambulatory Healthcare Strategy now offers ongoing retainer-based infection control oversight, which includes an annual infection control mock survey, or more frequently if you wish, review and revisions to your infection control program annually and as needed, annual competencies for your staff on infection control, and that's done during the mock survey, annual training on infection control, also done during this survey, and that's designed for your staff, assistance in investigations of any infections that you might have, assistance in preparing your annual infection control risk assessment, and of course access to all of the AHS infection control resources that our clients have come to rely on.
And for more information on our retainers, visit the Ambulatory Healthcare Strategies website at ah-strategies.com, or call John Goehle at 585-594-1167.
So we're back here, and the puppy is resting comfortably between the two of us here. I think she's waiting for her food, but
or we've just bored her because she looks like she's falling asleep.
Yeah. So we had a recent question about LGBTQ+, and these are often uncomfortable conversations. A lot of our centers probably rarely run into the situation, but it happened in one of our centers recently. So LGBTQ+ refers to lesbian, gay, bisexual, transgender, and queer, or questioning. What you need to do is make sure that your staff is educated on how to handle it before the situation occurs. And I think that was the challenge that we had with this one client is that they actually hadn't gone through the training. We do offer the training to all of our clients, but not everybody decides to take us up on that. And by the way, that same training is available on the for patron members of the podcast here, so right at the ASCPodcast.com website. Again, as we mentioned, we do really recommend annual training on this. In some states, this is actually required. And recognize that state laws are going to vary. So make sure that you're aware of your state law as we talk about this a little bit more. The important thing here is to do everything possible to improve the patient experience, make sure that the patient is as comfortable as possible. You don't want them to be upset or and we also need to make sure that your staff remains non-judgmental, but assure the safety of the patient. So the biggest issues that we run into periodically is the use of pronouns and nouns when addressing the patient. It's best to ask the patient how they wish to be addressed and document that in the medical record. And we know that medical records, unfortunately, especially EMRs, aren't necessarily designed to be able to gather this information well. Even paper records have a hard time, but at least on a paper record, you can write something off to the side of it. But I would encourage you to talk to your vendors to make sure that you have that option. It comes under that section even when you choose male or female sex. Now, some of the new AMRs are coming out with other options, but at the very least have a blank box there for being very specific.
Yep, and it's really best to just ask the patient how they would like to be addressed, and then document that.
As I mentioned earlier, I do suggest that you talk to your vendor, your software vendor, about adding the ability to write in the sex designation, since these designations are rapidly evolving. For example, you might want to make use of the notes to indicate the status. For example, a biological male identifies himself as a female and wishes the staff to use the pronouns she and her. So that type of documentation in your medical record makes it very clear for everybody as to both what the actual biological sex is for medical reasons and the way they wish to be addressed. And then we also had recently a very interesting case with pathology. And I don't want to go into too much specifics about this particular situation, but what basically happened is the specimen was handled incorrectly in two ways. First of all, the facility mislabeled the documentation. It had the wrong patient's name. But then when the staff member went in and looked at the case, they realized that the proper pathology tests were not performed. And when they questioned the pathologist, he says, "Well, you should have asked for additional tests to be done." And our nurse administrator, called him back and said, "But that's included in this standard, pathology test that we requested." And the pathologist argued with her and said, "Well, mistakes happen." And the whole lackadaisical attitude that he had really turned her off. And this wasn't the first situation. So here's my point on this, is that as a result of this, they switched pathology vendors. And she wrote this up as an incident report, which I bet many of you out there might not have done, but this is the proper way of handling it. And the reason being is, you and I talk about this a lot. You as a nurse, just like around the house here, you just fix things and don't make a big deal about it. And nurses in general do the same things at work. But this is a quality improvement issue. And it was great that she documented in the quality improvement meeting and that we demonstrated that we fixed this quality issue, albeit a very important quality control issue, one that she could have just handled by herself without making a big deal out of it. But we as surveyors like to see the documentation of this because it demonstrates that you are doing, a lot of work, a lot of oversight of the various responsibilities in the organization. It demonstrates that you are managing corporate compliance, that you're managing compliance with, the regulations here. And remember, on an annual basis, you have to document at the governing body level that all of your contracts have been reviewed for compliance with federal, state, and local regulations. So when at the end of the year, when they do that contract review, they are going to refer to this pathology issue and the fact that they terminated their arrangement with the pathologist and hired a new pathologist as a result of this. So, as I said, many places probably wouldn't have documented through the quality improvement program and certainly wouldn't have documented for the governing body, but we did that in this particular case, and that's because we had a very astute nurse manager who, really understood completely what quality improvement is and the importance of documenting all of these processes. I just kind of want to reemphasize something that we talk about frequently in this podcast is that as surveyors, I want to see that quality improvement permeates every aspect of your operation, that you're constantly looking at opportunities to improve quality in your organization, be it, the formal processes that we have out there for incident reporting or kind of those unusual things like this pathology that showed up. And by the way, when we talked about the LGBTQ plus situation earlier, that also showed up as a quality improvement activity so that we could demonstrate that we identified an issue, we did whatever retraining we needed to do, and we resolved this right through quality improvement and right up to the board. Now, in this case, the board didn't have to be involved because there was no change in the policies of the organization. But with the pathology, of course, they did have a new contract with a new pathologist, and that is something that required governing body approval. So let's take a break, and we'll come back and we'll have a very quick list of upcoming events in the ASC industry.
You're never alone in the ASC industry. Many organizations are eager to provide an opportunity to help you keep up on all aspects of running an ASC, and in this section, we highlight upcoming events.
If you would like your event to be included in the podcast, please send the event information to info@ascpodcast.com. And Sue, I'm having a hard time even researching this since so many organizations have gone to virtual conferences. These are not easy to find. And of course, a lot of them are, like California, for example, is doing a lot of webinars right now. I think Florida's doing the same thing. So it is difficult for us to get all of this information. So I'm actually going to provide a link on our website to the ASC Association section of their website where they have a list of all the state associations. So for each of you that have an association in your state, you might want to visit their website periodically to see what they're up to. So the Accreditation Association for Ambulatory Healthcare, AAHC, transitions its Achieving Accreditation Conference to a virtual environment. And this immersive educational seminar will take place. The first one takes place September 14th through the 17th, and is designed to help organizations develop and strengthen tools and resources to build a quality improvement culture that is integrated into their day-to-day operations. So for more information, visit AAHC.org.
And Becker's Orthopedic and ASC Virtual Forum, August 26th and 27th. Go to beckersasc.com, and they have several other virtual forums and conferences.
Yeah, there's actually a lot going on. They, like us, have really stepped up during this time. Of course, Becker's is much more than just ASCs. There's also hospitals and other organizations there, but they really have stepped up with their virtual conferences also. And the New York ASC Association will hold 4 virtual sessions. They're going to be managed out of our studios here in Rochester. And they're going to be Monday, September 14th, Wednesday, September 16th, Monday, September 21st, and Wednesday, September 23rd in the afternoons. I think it's between 2 and 4. And for more information, visit nysaasc.org.
The California Ambulatory Surgery Association, casurgery.org, has gone big time into the virtual conferences. Visit their website at casurgery.org for a full list of upcoming virtual conferences. And John will be doing an exciting ASC Financial Bootcamp on Friday, October 9th.
And that didn't actually sound sarcastic then when you said exciting.
Well, that's it for this episode of the ASC Podcast with John Goehle. Join us again, and please consider becoming a patron by going to our website at ascpodcast.com and spread the word about our podcast with your friends and colleagues, and do us the honor of hitting the subscribe button.
The sound editor for this episode is Susan Cronkite. Executive producer is John Goehle. Research assistance is provided by the wonderful staff at Ambulatory Healthcare Strategies: Susan Cronkite, Jenna Alvarez, Judy D'Ambrosio, Alex Borneman, Zach Calritis, and Lori Rodericks. Music is provided by Media Sushi and Mike Noah, and the ASC Podcast with John Goehle is hosted on Podbean and is available on all major podcast channels.
This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all the rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development, all rights reserved. We would like to thank this week's sponsors. First, Ambulatory Healthcare Strategies, one of the nation's leading regulatory compliance and financial oversight firms. For a free consultation, contact John Goehle today at 585-594-1167 or through email at info@ah-strategies.com. And Eden Group Development, which publishes ASC Regulatory Compliance Series, the ASC industry's leading books including the Survey Guide for ASCs, a guide to the CMS Conditions for Coverage and Interpretive Guidelines for Ambulatory Surgery Centers, and Ambulatory Surgery Center Governance, a guide for ambulatory surgery center owners and governing body members. These must-have books are available on Amazon and Barnes & Noble or directly from the publisher at reg-books.com. That's reg-books.com. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.